Today, I will be discussing psilocybin and its role in the treatment of depression, with a focus on both its pharmacokinetic and pharmacodynamic properties and how these contribute to its effects and abuse potential. Psilocybin is a naturally occurring psychoactive compound found in certain species of mushrooms, often referred to as magic mushrooms. Historically, it has been used in spiritual and cultural rituals for its ability to alter perception and consciousness. In modern research, psilocybin has gained attention for its potential therapeutic effects, particularly in the treatment of major depressive disorder. Once ingested, psilocybin is converted in the body into psilocin, which is the active compound responsible for its psychoactive effects. Psilocybin produces a range of psychological effects that are especially relevant for depression. Effectively, individuals often report improved mood, emotional release, and a sense of connectedness. Cognitively, psilocybin can alter self-perception and reduce rumination, which is the repetitive negative thinking commonly seen in depression. Behaviorally, individuals may become more open to new experiences and more engaged in therapeutic processes. These combined effects contribute to its potential as a treatment for depressive disorders. Psilocybin is most commonly administered orally in clinical settings, usually in capsule form. After ingestion, it is absorbed through the gastrointestinal tract. It is then rapidly converted in the liver into psilocin, which is the active form that produces psychoactive effects. Because it is taken orally, the onset of effects is slower compared to inhaled or injected drugs. However, this slower onset allows for a more controlled and sustained experience, which is important in therapeutic settings. Behaviorally, individuals may become more open to new experiences and more engaged in therapeutic processes. These combined effects contribute to its potential as a treatment for depressive disorders. Once converted into psilocin, the drug is able to cross the blood-brain barrier and distribute throughout the brain. Psilocin has a half-life of approximately 2 to 3 hours, meaning its effects are relatively short-lived compared to some other psychoactive substances. It is metabolized in the liver and eventually excreted through the kidneys. There is limited evidence regarding depot binding, and psilocybin is subject to first-pass metabolism, which influences its overall bioavailability. Psilocybin primarily affects the serotonin system in the brain. More specifically, psilocin acts as an agonist at the 5-HT2A receptor, meaning it binds to and activates this receptor. Activation of these receptors increases activity in certain areas of the cortex and alters communication between different brain regions. The pharmacodynamic effects of psilocybin help explain its impact on depression. By activating 5-HT2A receptors, psilocybin disrupts rigid patterns of brain activity, particularly in networks associated with self-referential thinking and rumination. This allows individuals to break out of negative thought patterns and experience new perspectives on themselves and their environment. As a result, individuals often report reduced depressive symptoms, improved mood, and increased psychological flexibility. Psilocybin has a low risk of physical dependence. While tolerance can develop quickly with repeated use, this is primarily due to pharmacodynamic factors, such as receptor downregulation. There is little evidence of significant withdrawal symptoms when use is stopped. Additionally, psilocybin does not strongly activate dopamine reward pathways, which are typically involved in addiction. Overall, psilocybin has a relatively low potential for abuse compared to many other psychoactive drugs. It does not produce strong reinforcing effects, meaning users are less likely to engage in repeated or compulsive use. The intensity and unpredictability of the experience may also discourage frequent use. Furthermore, the rapid development of tolerance reduces its effectiveness when used repeatedly in a short period of time. Together, these factors contribute to its low addiction risk.